Now we have to go to the action plan for refugee and migrant health in the WHO region. And so now I would like to proceed with our last technical agenda item. For this item, the relevant documents are displayed on the screen. So I would like to invite to watch a short introductory video to set the whole picture of the agenda item which is ahead of us. Please, can we have a video?
برای خود من پیش اومد و رفت دادم بیمارستان. یا آقایی بود قشنگ منو پس زد، هل داد. گفتش که تو اینجا پناهنده ای، بعد اول کار ما انجام بشه.
Y tal vez es verdad que es la primera vez que me encuentro con un bebé y es en otro sistema de salud, entonces seguramente hay cosas que yo no estaba tampoco preparada. Pero como europeo, sí que yo pensé que sería mucho más rápido tener la carta vital y no fue así. Durante un gran periodo no tener acceso, tenías acceso pagando, pero no tienes acceso que te puedan reembolsar después.
اللاجئ هو الشخص الذي فقد كل شيء وهو يبحث عن الأمان بالدرجة الأولى.
Türkei, Griechenland, dann Mazedonien, dann Serbien, dann Ungarn, dann Österreich, dann Deutschland. 7.
Erster Gedanke, dass wir irgendwann mal unterwegs sterben können.
سفر ما از ایران تا یونان تقریباً 1 سال طول کشید. تو این 1 سال دسترسی به هیچ امکانات بهداشتی نداشتیم یا دسترسی به دکتر یا دارو نداشتیم.
Поэтому я поняла, что мне будет немножко сложно, к тому же я приехала с ребенком. Стать медсестрой – это было главное, чтобы войти в медицинскую среду.
Azad hatte Asthma auch. Atemschwierigkeiten. Wenn man als Eltern eigene Kinder nicht helfen kann, wieso sind wir die Eltern dann?
به یک کشور دیگه رفتی هیچ زبانی بلد نیستی و بری بیمارستان و بخوای کمکی بگیری و اگه اونجا بهت کمک نکنن میتونی اونو فقط تصورش کنی؟
Your life is linked with the document.
هیچ مدرکی ندارن، بلا تکلیف نمیتونن بیمارستان و دکتر هم برن.
The people around me was like, oh, go to your country because we are not here to pay for your health. It's a xenophobia. Islamophobia is there also.
Hier die passende Untersuchungen, passende Gesundheitsversorgung.
Die alle werden gleich behandelt.
Gleichbehandlungen in gesundheitliche Dinge. Sollte man als Menschen überall behandelt werden. Nicht als Deutsche oder als Syrer oder als Iraker oder als Afghaner oder als Afrikaner.
Menschen
Egal wer.
sind Menschen.
Thank you very much for this video. It's also very sensible and impressive. So the draft action plan for refugee and migrant health in WHO European region for 2023-2030 intends to support countries to make health for all, including refugees and migrants. So the document actually needs to make it a reality. In this session, the regional committee is invited to consider a new regional action plan for the period 2023-2030, as well as a related draft decision. Now I would like to invite Dr. Gunda Wheeler, Director Division of Country Support and Partnerships, who will present the key directions of the action plan. Mr. Wheeler, please, you have the floor.
Thank you, Mr. Chair. We have just heard the health stories of refugees and migrants across our region. Let me add my own story. Behind me, you can see my mother, the young girl in the picture in the middle. At the age of 10, she and her family had to flee their home. Her story as a displaced child experiencing trauma and illness impacted her and our family profoundly for life. Migration and displacement in Europe and Central Asia have many faces, and migrants are an inherent and enriching part of our past, present, and future. People migrate for many reasons, from work, studies, to urbanization, and at the same time, many people are displaced due to conflict, disasters, and climate change. 1 in 8 people is a refugee or migrant in Europe and Central Asia. Of the more than 100 million migrants in the European region today, more than 60 million are labor migrants, 12.5 million refugees, and more than 1.5 million are students, to name a few. Migration and displacement have a significant impact on our health systems. The health of migrants and refugees goes hand in hand with the health of host populations. The action plan in front of you is about reaffirming our joint commitment to the right to health, safety, and dignity for all, including refugees and migrants, and to act on it. The right to health applies to all, no matter who, where, and where from. Why do we need a new action plan for refugee and migrant health? Our region made significant progress through the previous action plan, 2016-22. Over the past 5 years, millions of people have crossed borders to a new life. Member states have made enormous strides to make their health systems more accessible and inclusive for these refugees and migrants. Compared to 5 years ago, countries have increasingly included refugee and migrant health in their national and local policies and practices. The majority of member states now have a contingency plan for large arrivals of refugees and migrants. And we've seen unprecedented efforts to include refugees and migrants in the response to COVID-19. Thank you. But at the same time, we have to acknowledge reality. Our region is in a perma-crisis with multiple ongoing challenges from conflicts to climate change. Refugees and migrants are too often amongst the most vulnerable. Now more than ever, we need to make sure good health is not determined by where someone comes from. The stories you heard in the video remind us of important lessons we have learned throughout the past 5 years. First, refugees and migrants are an enormously diverse group who need differentiated solutions based on respect and inclusion. Second, just as migration connects regions and countries, we must partner across borders in a whole-of-route approach. And third, and most importantly, migration can be an enormous asset for our health systems, societies, and economies. Last year, at this regional committee, you tasked us to develop an action plan that builds on these lessons and tackles the remaining gaps. We've consulted you, member states, partners, and civil society organizations, including refugee and migrant representatives. The result of these extensive and participatory discussions is in front of you today. The new action plan proposes a new common vision on health and migration for our region. It outlines strategic actions needed at country and regional levels, provides indicators for monitoring how we progress, and spells out how WHO will support you. The action plan is based on the following 5 pillars of action. First, ensuring refugees and migrants benefit from universal health coverage, which means extending access to essential and high-quality health services. Second, implementing inclusive emergency and disaster risk reduction policies and actions by, for instance, including refugees and migrants in emergency preparedness and response plans that we've just talked about. We will be hearing from my colleague next about how refugees were impacted by the recent earthquake in Turkey and what the lessons learned are. Third, developing inclusive environments that promote public health, social inclusion, and well-being, joining the dots between the social, economic, and environmental determinants for health, through offering access to education, supporting workforce participation, encouraging community engagement, for example. Fourth, strengthening migration and health governance, evidence and data-driven policy making, from clear administrative processes to ensuring detention is a last resort, to facilitate safe, responsible, and dignified migration. And fifth, migration and health will always remain a cross-cutting subject. That's why the last action pillar promotes partnerships in recognition of the whole of society and whole of government approach needed. Through these actions, the plan will also translate and operationalize global instruments governing health and migration. This includes aligning with the Global Action Plan on promoting the health and refugee of migrants, the health of refugees and migrants, which you just extended at the last World Health Assembly. This is your action plan. It has the potential to drive change in each of your 53 countries according to your context and your realities. Let me now ask our representative to Turkey, Dr. Batir Badiklivic, to brief us how WHO supported the authorities there in ensuring refugees and migrants were included in the response to the February earthquakes.
Thank you, Gunda. Distinguished delegates, dear colleagues, I have to note that the topic of this session is extremely relevant for me and for my colleagues in WHO country office in Turkey, and it actually constitutes significant part of WHO work in the country. We know that Turkey hosts one of the biggest refugee populations in the world, with more than 4 million of displaced people, most of whom are Syrians, fleeing from the long-lasting conflict in their homeland. The reality is that with the time, migrants and refugees inevitably become part of a society. And with that, the Turkish government has to allocate substantial resources to address health and other needs of this big group. WHO has been closely working with the Ministry of Health to complement their efforts in providing healthcare services for this group. And this work actually started long before this devastating earthquake, which hit southeast part of Turkey this February. Our efforts were focused and has been focused on continuous training and capacity strengthening of Syrian, but also Turkish healthcare workers for provision of culturally and linguistically sensitive essential health services. We trained more than 6,000 healthcare workers during this period. I also would like to note that Kahramanmaraş earthquake was a real tragedy for the whole nation, for the whole society, host population and refugees. But it's important to stress that during the earthquake response led by the government of Turkey, Refugees and citizens of Turkey receive the same level of support of medical care without any differentiation. Health services provided in Turkey in general are free of charge, and including for refugees, and this is a very important component. At the same time, we understand that under such circumstances and in emergency situations, refugees and migrants are very often among those who are most vulnerable. Therefore, WHO, together with other UN partners and earthquake response actors, adopted the principle of leaving no one behind, prioritizing all the resources we received from the international community for addressing the needs of the most vulnerable, women, children, disabled people, but also refugees and migrants in health. Today's discussion of the new action plan on refugee and migrant health is very timely, and I believe that it has great value because it's supposed to encompass and present the common vision of member states and also donor community on the key aspects, key activities to address health needs of the refugees and migrants, but also to enable their contribution to the well-being of the whole society. I would like to conclude here and pass the floor back to Gundo for the final remarks. Thank you.
Yes, thank you, Batia. We know that change is hard, but examples such as Turkey inspire us and show how WHO can work alongside all of you to safeguard the health of refugees and migrants. The action plan in front of you is a compilation of measures that work based on your contributions and experiences. They apply to Gulizar and Mahmoud, the Syrian couple whom we saw in the video who found refuge in Europe. They apply to Ava, who came with her son. They apply to Nasruddin, the Afghan researcher, now working as a translator in Europe. And they apply to Larissa, who became a nurse in a new home country. They are relevant for all of us in this room. Let us use your leadership to drive change by assuring access to health for all, no matter where you come from. Thank you. And back over to you.
Thank you very much. Thank you very much, Dr. Wheeler. And also thank you very much, Dr. Berdichev. It is very important to see a country perspective when implementing this action plan, and Turkey is one of the best examples in this topic. Now I would like to open the floor for any comments and remarks on what is required by member states in a short term in order to kick off the implementation of the action plan. If there are any member states who would like to take the floor, please raise your nameplate. Turkey, please, you have the floor, followed by Moldova.
Thank you, Chair. Actually, normally I have a long address for the committee to tell the Turkey's success story, but the Dr. Batır, our WR, also told our success story better than me. So to save the time, I will not deeply tell the Turkey's success story. Just I would like to state that Turkey is strongly supporting the action plan. I thank you.
Thank you very much, Turkey. Republic of Moldova, followed by Portugal. You have the floor, Republic of Moldova.
Thank you, Chair. Dear Director General, dear colleagues, the Republic of Moldova highly commends the development of the Regional Action Plan on Health of Refugees and Migrants and the inclusive consultation process that we have been engaged in over the past 2 years. Firstly, I would like to reaffirm our commitment to the right to health, safety, and dignity for all. It is a universal right for everyone, including refugees and migrants. The action plan could not be timelier. Refugee and migrant health is one of the most pressing challenges for our health systems. We need to address both the current health needs, but also look at long-term and structural issues our health system are facing. The 5 action pillars on the plan give concrete guidance for action, what needs to be done. Let me zoom into our national reality to give some practical example from the country level. In the Republic of Moldova, we organized and provided medical assistance at state border crossing points and centers for displaced persons from Ukraine from the first day of the war, receiving per day about 30,000 of refugees. National and international mobile medical teams provided health services directly. Moldova received and passed through more than 900,000 of people, Moldova having just 2.6 million. Urgent or surgical medical assistance services were provided free of charge to absolutely all refugees, including mental health care services. The Republic of Moldova became part of the European Civil Protection Mechanism, through which the medical evacuation of refugee patients was made possible. Refugees requiring further oncological treatments or treatment of rare disease and injuries were evacuated. We also developed the health contingency plan for the increased arrival of refugees, asylum seekers and migrants in the Republic of Moldova. It is the first in Eastern Europe. We also developed the sectoral plan for providing medical assistance in case of incidents resulting in multiple victims. Going forward, the action plan will guide our future actions on refugee and migrant health. I am confident that through implementing the 5 action pillars, we will not only contribute to health equity, but also improve global health at large. Indeed, we need to make our emergency responses and health system more inclusive. Dear colleagues, health does not begin or end at a country's border. I affirm our commitments to have equitable access to quality health services anywhere, at any time, regardless of where they come from, and will continue to support the Ukrainian refugees, women, children, people with disability, elderly people, supporting in this way peace. And maybe it's the time to say to politicians, please stop the wars in the world. Thank you.
Thank you very much, Moldova. Now, Portugal, following by Tajikistan. Please, Portugal, you have the floor.
Thank you very much, Honorable Chairman. Excellencies, Portugal's commends the Euro region for its pivotal role in coordinating and leading efforts on this crucial matter. Our commitment to promoting the health of refugees and migrants is unwavering, with the primary goal of fortifying health systems to be sensitive and inclusive to their needs, ultimately achieving universal health coverage and upholding the fundamental right to health for all. We commend the guidelines and support given to Member States in translating the vision of health for all, which encompasses refugees and migrants into a tangible reality, as we have seen. Our core belief is that health, regardless of nationality or legal status, is an integral part of universal health coverage. We also hope for consensual agreement throughout the region on this matter, leaving no doubt that every member state recognizes the significance of ensuring that refugees and migrants enjoy access to universal health coverage and the creation of inclusive environments that promote public health, social inclusion, and overall well-being. This is our shared mission and responsibility. Excellencies, partnerships are essential for achieving the results and the impact we need. Addressing complex health needs in society requires strong connections between various stakeholders and active participation from different disciplines. It's in this regard that I would like to applaud the initiative that brings together the WHO regional offices for Africa and for the Eastern Mediterranean and member states to work on migrant health. We acknowledge that there's much work ahead of us. As a collective effort among nations, we must provide better support to migrants, in their home countries, along their migration journey, and at their destination. This necessitates the effective implementation of a comprehensive approach that covers the entire migration route. In Portugal, we are strengthening our efforts to integrate the health needs of these populations across all sectors, advocate for solutions that extend beyond the health domain, and improve the quality of data on the health of refugees and migrants, which is currently fragmented. We find ourselves on the threshold of a new era in how we address the health needs of refugees and migrants. Together, we have the power to create a profound and enduring impact. Thank you very much, Ahmed.
Thank you very much, Portugal. Now I'd like to give the floor to Tajikistan, following by Germany. Tajikistan, please, you have the floor.
Уважаемый господин председатель, уважаемые коллеги, Республика Таджикистан выражает свою приверженность в обеспечении мер политики и программы в области общественного здравоохранения с учетом потребностей беженцев и мигрантов, а также выступает за распространение охвата соответствующими программами медико-социальной помощи для вышеуказанной категории лиц. Мы поддерживаем предложенный план действий в отношении здоровья беженцев и мигрантов в Европейском регионе ВОЗ на 23-30 годов, цель которого заключается в том, чтобы сформулировать для региона общее перспективное видение в сфере здоровья и миграции и обозначить стратегические шаги, необходимые для реализации потенциала миграции как фактора повышения продуктивности и жизнестойкости населения, а также построения экономики благополучия для всех. Опираясь на основные значимые аспекты, необходимо выделить следующие стратегические направления, как обеспечение всеобщего охвата услугами здравоохранения, в том числе для беженцев и мигрантов, принятие инклюзивных стратегических мер реагирования на чрезвычайные ситуации и снижение риска бедствий, а также создание инклюзивной среды, способствующей укреплению здоровья и повышению уровня благополучия. В свете вышеуказанного Таджикистан принял активное участие в совещании высокого уровня по вопросам здоровья беженцев и мигрантов в Стамбуле, Турции, также в Шарм-аль-Шейх и Египте, участники которого единогласно поддержали проект итогового заявления, что стало наглядным примером многостороннего сотрудничества и готовности в разработке нового регионального плана действий в области здравоохранения и миграции. Региональный план действий необходим для практической реализации глобальных обязательств в сфере здравоохранения и миграции с учетом регионального контекста и в соответствии с региональными приоритетами и имеющимися фактическими данными. Охрана здоровья беженцев и мигрантов – это неотъемлемая составляющая общественного здравоохранения. Пандемия COVID-19 заставила нас обратить внимание на значимый вклад беженцев и мигрантов, их жизнестойкость. Республика Таджикистан, признавая процесс миграции как важный компонент социокультурного, гражданского, политического и экономического развития и процветания Европейского региона ВОЗ, и что здоровье беженцев и миграции является неотъемлемой частью здорового населения, выражает свою готовность поддержать существующие или при необходимости новые механизмы координации и диалога для содействия более широкому многосекторальному, международному и межрегиональному взаимодействию в области здравоохранения и миграции. Мы выступаем за укрепление научных и образовательных партнерств в области здравоохранения и миграции, в особенности в странах с низким и средним уровнем дохода в европейском и соседних регионах, а также дальнейшее взаимодействие с сотрудничающими центрами ВОЗ. Благодарю за внимание.
Большое спасибо, Tajikistan. Thank you very much, Tajikistan. Now I'd like to give the floor to Germany, following by Hungary. Please, Germany, you have the floor.
Deutschland unterstützt die Erstellung einer neuen und weiterführenden Strategie und eines Aktionsplans für den Zeitraum von 2023 bis 2030. Die im Jahr 2016 begonnene erfolgreiche Zusammenarbeit muss fortgeführt werden und Antworten auf die aktuellen politischen Herausforderungen und Fragen bringen. Aufbauend auf den Erfahrungen mit dem bisherigen Aktionsplan und im Zusammenspiel mit den nationalen Regelungen und Maßgaben sind die vorgeschlagenen 5 Handlungssäulen eine gute Grundlage für die weitere Zusammenarbeit mit der WHO Europa. Flucht und Vertreibung sind leider Themen, die uns ganz aktuell und auch in den nächsten Jahren weiter intensiv beschäftigen werden. Durch den andauernden russischen Angriffskrieg gegen die Ukraine, als auch durch zunehmende militärische Konflikte in der Sahelregion, ist die Zahl der Menschen, die Schutz in der europäischen Region suchen, hoch und stieg zuletzt wieder deutlich an. Umso wichtiger ist es, gemeinsam nach Lösungsansätzen zu suchen, die das gesundheitliche Wohlergehen von Flüchtenden und Migrierenden sicherstellen. So unterschiedlich die Ausgangslagen für die verschiedenen Herausforderungen auch sind, sie haben uns gezeigt, wie wichtig internationale Zusammenarbeit und wie unabdingbar eine gute gesundheitliche Versorgung für alle ist. Deutschland dankt der WHO für den intensiven und erfolgreichen Austausch der letzten Monate. Wir teilen mit dem Aktionsplan entwickelte gemeinsame Vision für den Bereich Migration und Gesundheit in der europäischen Region. Besonderen Dank äußern wir auch dafür, dass unsere Anmerkungen Eingang in den finalen Aktionsplan fanden. Wir hoffen, den aktuellen Herausforderungen so gemeinsam begegnen zu können und sind uns sicher, dass wir uns auf den stetigen Austausch mit allen Mitgliedstaaten und Partnerorganisationen verlassen können, um so niemanden zurückzulassen. Vielen Dank.
Thank you, Germany. Now I'd like to give the floor to Hungary, following by Lithuania. Hungary, the floor is yours.
Thank you, Chair, distinguished Regional Director, Excellencies. Hungary hereby presents the explanation of its national position regarding the Action Plan for Refugee and Migrant Health in the WHO European Region 2023-2030. It is regrettable that the Action Plan references several times the Global Compact on Migration and the Global Compact on Refugees, neither of which has been accepted by Hungary. The Hungarian position is clear and consistent. Migration is not a fundamental right, so any reference to the GCM and GCR is unacceptable for us. Therefore, Hungary disassociates from the points containing references to this. Furthermore, we would like to highlight that the action plan refers to migration as a phenomenon which contributes to social and economic development. Hungary can't agree with this position, as we do not support incentives for migration. We don't agree with the approach that everyone, including illegal migrants, are entitled to enjoy the same quality of healthcare regardless of their insurance or healthcare coverage status. We cannot adopt any legislation nor decision that will discriminate our citizens in this regard by providing migrants healthcare services without prejudice to their legal status or national health insurance coverage. Lastly, but most importantly, a legal distinction must be made between the concepts of legal and illegal migration. The range of healthcare services that can be provided to persons belonging to each category is diverse and has to be differentiated. Thank you.
Thank you very much, Hungary. Now I would like to give the floor to Lithuania, following by Kazakhstan. Lithuania, you have the floor.
Thank you, Chair. Lithuania welcomes the Refugee and Migrant Health Action Plan for the WHO Europe region for the period of 2023-2030. Our evaluation of this plan underscores its well-structured nature, featuring clearly defined guiding principles, strategic priorities, as well as insights of monitoring and evaluation. Suggested 5 main areas of action are perfectly aligned with Lithuanian priorities. We recognize the imperative of enhancing universal health coverage for refugees and migrants, addressing both their immediate and long-term health needs. One critical aspect we emphasize is the integration of these individuals into our society, creating an environment that fosters public health, social inclusion, and general well-being among migrants and refugees, direct impacts their overall health, including both their physical and psycho-emotional well-being. Furthermore, we stress the importance of considering the unique health needs of refugees and migrants when formulating emergency and disaster risk reduction policies and actions. This socially vulnerable group is disproportionately affected in extreme emergency and disaster situations, necessitating specific attention and tailored responses. We want to underscore that achieving the aforementioned objectives is contingent on the boosting of migration health governance and the implementation of evidence-based and data-driven policy making. It is essential to explore new collaboration pathways and innovative approaches to partnership in order to achieve more sustainable progress in this vital area of public health. I thank you.
Thank you very much, Lithuania. Now I would like to invite Kazakhstan, following by Slovakia. Kazakhstan, you have the floor.
Спасибо, уважаемый председатель. Уважаемые участники конференции, процессы миграции населения носят межсекторальный характер и способны в значительной степени влиять на здоровье и благополучие людей. В условиях современных вызовов и чрезвычайных ситуаций в мире особенно актуально соблюдение принципа здоровья для всех, в том числе для беженцев и мигрантов. В этой связи очень важно обеспечить население всеобщим охватом услугами здравоохранения, осуществлять инклюзивные меры политики по снижению риска чрезвычайных ситуаций и катастроф, укреплять стратегическое руководство в сфере миграции и здоровья, благополучия населения и социальной интеграции. Казахстан в указанных вопросах привержен. На законодательном уровне в стране определено правовое положение лиц, ищущих убежище. Беженцы и иммигранты, иностранцы и лица без гражданства, постоянно проживающие на территории Республики Казахстан, имеют право на получение гарантированного объема бесплатной медпомощи наравне с гражданами Республики Казахстан. Указанная категория лиц, временно пребывавших в Казахстане, имеет право на получение гарантированного объема бесплатной медицинской помощи при заболеваниях, представляющих опасность для окружающих. Кроме того, они несут те же обязанности в области здравоохранения, что и граждане Республики Казахстан, в части прохождения обязательного медицинского осмотра. Вместе с тем, с целью расширения доступа к спектру медицинских услуг для беженцев и мигрантов, в текущем году на законодательном уровне отрегулировано получение медицинской помощи в рамках вмененного медицинского страхования. Вмененное медицинское страхование является видом медицинского страхования для иностранцев, временно пребывающих в Республике Казахстан, позволяющим получать медицинские услуги в медицинских организациях первичной медико-санитарной помощи, специализированной медицинской помощи в стационарных условиях в экстренной форме. Таким образом, Казахстан поддерживает многосторонний и межведомственный диалог для обеспечения безопасной и законной миграции и план действий в отношении здоровья беженцев и мигрантов в Европейском регионе ВОЗ. Благодарю за внимание.
Thank you very much, Kazakhstan. And now I would like to invite Slovakia to take the floor, please.
Thank you very much, Chair. Slovakia welcomes all activities on the level of WHO regional office and their relentless effort for the best and suitable solutions for everybody and for all the countries with all the limitations. And we know that limitations are really huge in development and implementation of UHC. Even despite we proved, all of us, in September in Yunga, in the beautiful city of New York, that we are implementing UHC. But to implement, and implement means something different. And sometimes we are giving a lot of political borders, and we are following structures for our decisions which are not linked to prediction of the future. Based on many studies and experiences in many countries, we can observe that sooner or later, for all of us who are not implementing appropriate services for refugees and people in need from the groups of the migrants, expenditures could be even higher. This is also example of Slovakia, and we went through the journey of our recognition of important involvement in this field and implementation of the services. So therefore we welcome all the activities and also this action plan for implementation and support of the countries. And regarding to the activities which are held by regional office and also emergency and migration team together, including 3 regional meetings in Egypt and Morocco, which was very helpful to understand how contextualization could be used for best approach and utilization also of the incentives and investment into this specific and very sensitive area. So we very much appreciate also sub-regional consultation which was held in Bratislava in Slovak Republic in April related to the conflict in Ukraine, and it was having very comprehensive approach and also content of what we have discussed and the outcomes in different fields in mental health, but also essential health services and leadership, but also how to sustain the financial hardship for the implementation is very much recognized, and we would like request the WHO regional office to continue in technical leadership and also technical meetings related to this measure, not only due to the Ukraine, but also due to influx of other refugees, especially the Syrian in these days. Thank you very much for all the effort, and we fully support the implementation of the process.
Thank you very much, Slovakia. And as I don't see any other member states who's willing to take the floor at this moment, I would like to invite our international partners. So first, I give the floor to the CIS Interparliamentary Assembly. Please, you have the floor.
Благодарю вас, господин председатель. Уважаемые коллеги, хотелось бы отметить, что приветствую деятельность Европейского бюро ВОС в отношении подготовки и реализации плана действий в отношении здоровья беженцев и мигрантов. Межпарламентская ассамблея хотела бы сообщить о том, что ей были приняты документы, которые в качестве модельных и комплексных в том числе решают вопросы медико-социальной защиты беженцев и мигрантов. Это такие документы, как модельный миграционный кодекс, модельный трудовой кодекс, модельный закон о беженцах. Для нас большая честь заявить о том, что в период пандемии Европейским бюро ВОС совместно с Международной организацией по миграции и Межпарламентской ассамблеей государств-участников СНГ было подготовлено специальное заявление, которое касалось вопросов как сохранения трудовых мест и социальной защиты беженцев и мигрантов, так и вопросов медицинской помощи для этих уязвимых категорий населения. Хотелось бы сказать, что в части реализации указанного плана действий мы могли бы сообщить о начале подготовки такого документа, как рекомендации по законодательному регулированию миграционных процессов в период пандемии и других чрезвычайных ситуаций в части общественного здравоохранения. Наши документы могли бы служить универсальным инструментом имплементации положений по социальной и медицинской защите беженцев и мигрантов в региональное и национальное законодательство государств, заинтересованных в рассмотрении этих положений. Позвольте сообщить о том, что в самом широком доступе будут находиться проект этих рекомендаций. Если будут предложения по внесению каких-то дополнений, замечаний, совместной работе, мы всегда будем в распоряжении тех, кто к нам обратится. Благодарю за внимание.
Thank you very much. Now I would like to invite Eurasian Economic Commission. Please, you have the floor.
Спасибо большое за предоставленное слово. Уважаемые коллеги, от лица Евразийской экономической комиссии хотелось бы вас благодарить за приглашение, особенно за приглашение именно к работе данного документа, так как это наш самый такой основной, хороший такой опыт взаимодействия совместно с ВОЗом было. Над этим документом работали, вот плодотворная встреча у нас была в Ларнаке весной этого года, где мы могли обозначить все наши необходимые моменты, которые мы хотели в нем видеть. Поэтому на данный момент этот документ мы полноценно поддерживаем его, так как для Евразийского экономического союза он основывается на 4 столпах, и один из главных столпов – это свобода передвижения человеческих ресурсов. Поэтому с каждым годом динамика роста миграции растет регулярно, постоянно, и обеспечение их к доступам социальным и особенно к медицинской части является самым актуальным. Также у нас есть хороший опыт, очень много больших достижений. Это в части обеспечения трудовых мигрантов, необходимым к системе здравоохранения, к доступу, так как знаете, да, что они в основном мигранты работают на очень тяжелых производствах, на работах опасных. Поэтому то есть, этот вопрос самый основной важный. Сейчас мы очень активно работаем над обеспечением членов их семей, это женщин, детей. Поэтому ваш опыт ВОЗа для нас будет самым приемлемым, то есть, который мы хотели бы также использовать в своей работе. И хотелось бы, чтобы этот план в итоге был у нас имплементирован на достаточном уровне. И как площадка мы, в принципе, тоже готовы к различным пилотным проектам совместным. И призываю также другие организации к данной работе привлечься очень активно. Спасибо большое.
Thank you very much, and we appreciate our international partners for their interventions. Now, the Secretariat has received a request for a joint statement to be delivered by Ms. Mervi Jokinen from the European Forum of National Nursing and Midwifery Associations. So she will speak on behalf of the 5 different organizations. So Ms. Mervi Jokinen, you have the floor.
Honorable Chair, distinguished committee members and delegates, due to the humanitarian and climate crisis, Europe has experienced an unprecedented influx of migrants, refugees and asylum seekers. As the demographics of this population have changed, they now present broader sections of the population and present with increased vulnerability. These are not crises that will go away and can only be addressed by political commitment as well as inclusive approach in national health policies. We welcome the action plan for refugee and migrant health in the WHO European region, recognizing the role we have in supporting and enhancing the 5 action pillars. We acknowledge the challenges and inequalities that migrants and displaced people face in accessing healthcare and achieving best possible health outcomes and quality of life. Therefore, European health system must be equipped to care for migrant populations, many of them living with chronic diseases, and remove the barriers in accessing the necessary care and support. This in turn will contribute to the resilience and sustainability of European healthcare systems. In addition, migrant healthcare workers are shown to experience challenges in health and mental well-being, as well as economic and financial disparity in host countries. We agree with the principle that the member states must ensure the health workforce recruitment complies with and promotes the ethical principles embedded in relevant global instruments and codes of practice. To deliver the strengthened policies and realize the objectives in this action plan, and to deliver person-centered, inclusive and humane care in an environment of social cohesion and equity, We need a healthcare workforce that is governed by optimum supportive health system. 7 years is fairly short time for the plan of action, so we call all the parties to recognize their responsibilities in not leaving anyone behind.
Thank you very much for this intervention. So the Secretariat also received a written statement from International Association for Hospice and Palliative Care. So let me once again remind you to consult the written statements submitted by member states, international organizations, and non-state actors on the website of this regional committee. So I now would like to give the floor to Dr. Gunda Wheeler to provide any responses for your comments. Please,
Thank
Dr.
you.
Gunda, the floor is yours.
Thank you, Chair. So first of all, I want to thank you all for your very important and pertinent remarks and comments, emphasizing that this action plan is both. It's a sign of our commitment to health for all, but it's also a concrete blueprint for the Secretariat and for countries to address one of the most challenging issues that we have in front of us. So it's good to feel that to hear that you feel that the action plan will be relevant and meaningful, and thank you for pointing to the many examples from your various countries that have actually informed the development of the plan. So the ownership by governments and member states of this plan is very important. But what is equally important is that we had close involvement of non-state actors in the process. And I want to also thank here the non-state actors for their statements, in particular pointing also to the importance of the issue of the healthcare workforce, which bridges also to the plan that we've discussed earlier in the day. We're also particularly grateful to a range of NGOs that represent migrant and refugee populations that were actively involved in the dialogue that led up to the preparation of the plan. So you've pointed to a number of situations that lead to displacement and to migration. And as we've said, migration does have many faces. We didn't attempt in this plan to establish a hierarchy between the different situations, but rather spell out actions that apply across all situations. So I do need to note, of course, the comments by our esteemed colleague from Hungary on the applicability of the actions outlined in the plan. And I would like to reiterate that, as said in the plan, any provisions of services should take into consideration the national legal frameworks and policies. And we also note that Hungary, as are some other countries, have not ratified the global compacts that are indeed referenced in the plan, but they are not forming an integral part of the strategy, just to point that out. I would like to thank in particular CAS and the Interparliamentary Association and the Eurasian Economic Commission for raising the important issue of labor migration, which are also issues that are particularly relevant for Tajikistan and Kazakhstan, who both spoke in support of the plan. It is indeed the largest group of migrants in the European region, and a group that has particularly suffered from restrictions and movements and economic downturn in the COVID-19 pandemic. And I want to thank for the good collaboration that we had with you to protect migrants during the pandemic, and for your offer to share the results with all. As said by Moldova and many others, the process that led to the drafting of the action plan was particularly consultative, and Germany also pointed to that, including the member states, NGOs, but also a strong inter-regional component, which was important. And I want to thank in particularly Turkey, who hosted the first tri-regional meeting on migration and health in the last year, followed by a second high-level meeting this year. And I want to thank Portugal and Tajikistan for Slovakia, who all participated amongst many others. We had more than 50 countries participating in each of the consultations, for particularly appreciating those consultations which really formed the backbone for developing the plan. I just want to say that indeed we have the plan in front of us, but the dialogue that we have established along the way is really very important. I want to thank also Slovakia for organizing part of the dialogue by hosting an important sub-regional consultation for refugee hosting countries. And we certainly are fully committed to not only work alongside you to implement the plan, but also to maintain this high level of engagement and dialogue with all of you along the way. In anticipation, I already want to thank Malta for actually hosting one important meeting that will come up early next year, which is a knowledge forum, and it's one of the first events that we are organizing under the hopefully approved plan to start implement the plan and discuss with you all 5 pillars of the plan and how we can advance them in your respective countries. Thank you, and with this, back over to you, Chair.
Thank you very much, Dr. Gunda. And now I would like to invite our distinguished regional director, Dr. Hans Kluge, for the replies. Over to you.
Thank you, Professor Ranov. Dear colleagues, on day 1, I spoke about the need for resilient governance, resilient health systems, and resilient people. As many of you have underlined, refugees and migrants are amongst the most vulnerable populations. So let me reflect briefly on how they benefit from our effort to strengthen resilience, and vice versa, how advancing refugee and migrant health will make our societies more resilient. Number 1, resilient governance. If we promote better migration health policies, this will directly contribute to resilient governance. Number 2, resilient health systems. Migration is not just a crisis, it's really an enduring part from now on of our societies. The action plan will help us to harness the opportunities of migration and make our health systems more resilient. For example, through working with culture mediators and making the systems more migrant friendly. And finally, resilient people. Our action plan is all about health for all people, no matter where, no matter where from. The right to health is a human right for all. Thank you very much for your strong support to the action plan. I also would like to commend here my peers, the Regional Director of EMRO, Dr. Ahmed Al-Mandari, and the Regional Director of AFRO, Dr. Moeti Chihedi. They were both present in Istanbul last year when Dr. Fahrettin Koca hosted the first tri-regional meeting, high-level meeting on migrant health. And this year we went, the 3 of us together again, to Sharm el-Sheikh in Egypt. And Dr. Moeti has, at the end of that meeting in Sharm el-Sheikh, committed to host the 3rd tri-regional high-level meeting in the African region next year. So you see the commitment, and we always do it, as I told day 1, with WHO headquarters. I want to commend here Dr. Santino Sivroni for his very good collaboration. Thank you.
Thank you very much, Dr. Hans. And to conclude this item, we are now ready to consider the adoption of the proposed draft decision contained in the document EUR/RC73/conf./3 on the action plan for refugee and migrant health in the WHO European region for the 2023-2030. And I would like to ask the committee if the committee is willing to adopt the proposed draft decision by consensus. Well, I see no objections. And the decision is therefore adopted. Thank you.